And tonight we're joined by Dr. Lisa Fitzpatrick. She participated in the Moderna trial and is a CDC-trained medical epidemiologist. So, Doctor, thank you for being with us tonight.
Thank you for having me. Good evening.
Good evening. So a recent Kaiser poll showed that 35% of Americans say they won't even take the vaccine. First, why don't you start by telling us why you chose to participate in that trial, and what would you say to those people who are reluctant to take any COVID vaccine because they're worried about the long-term effects or because they don't trust the government, particularly people of color?
Sure, I hear these concerns a lot. I decided to enroll in the Moderna vaccine trial because a lot of my work involves community outreach, and I was hearing a lot of reluctance about the vaccine, concerns about the politicization of the vaccine, and I thought, what better way to educate the community about this vaccine and the scientific process it's undergoing than to participate in the trial. And it's actually paying off because just as recently as last Friday, I convinced a few gentlemen to consider the vaccine. And all I did was explain the process and explain how this is science and not politics.
And what was the process?
To those who are,
oh, I'm sorry,
go ahead. Who are concerned about the side effects, I had, I'm not sure if I received the vaccine or if I was in the placebo arm, but I would remind people that we are accustomed to this research process. All the medications people take that are prescribed by healthcare providers go through a very similar process as this vaccine. And in the phase 1 trial, we know the vaccine is safe. So I had a lot of confidence in taking the vaccine.
So did you not experience any side effects? If you said you're unsure if you got the placebo, did you have any side effects, soreness in the arm or fatigue or anything like that?
I did. I had soreness in my arm. I had some muscle aches, but it's often difficult to know exactly which injection you got. You know, sometimes the power of suggestion is very, very powerful. So hopefully I'll learn soon. As you may have heard, Moderna has intentions to unblind their study and let the participants know which arm they were in.
So now this is the second vaccine being rolled out. What are the main differences between the Pfizer and the Moderna vaccines?
I think the biggest one is about storage requirements. I think clinically and chemically, they're very similar. They both use the messenger RNA platform, but I think the side effects are pretty similar. We've heard a couple of cases of allergic reactions, but again, when you have tens of thousands of people in these vaccine trials, side effects are expected, and I think we will learn more about these vaccines and the side effects as time goes on. But again, I think with both of these vaccines, because the phase 1 trial showed that they were both safe, they've both been approved by the FDA, and that could not have happened if they had not been shown to be safe. So I want to reassure people that both of these vaccines went through a rigorous scientific process.
So we have troubling news out of the UK. Health officials there saying there's a new strain of the virus that's 70% more contagious. Are the vaccines going to protect against any mutations that might come?
I think that what we need to understand is the clinical impact of the virus. So far, we've had mutations identified over the past summer, but it really hasn't changed the clinical picture. So people aren't sicker because of the mutation. And remember, viruses mutate. Every time a virus copies itself, it's a bit imperfect, but that doesn't mean it'll be more lethal or it will cause more symptoms than we're accustomed to. So I think the contagiousness might be a concern, but I also think it's very early and we need more information to substantiate whether or not there's a cause for concern.
Well, Dr. Fitzpatrick, this would not be even available to anyone without volunteers like you. So thank you for your service and thank you for joining us tonight. Appreciate having you.
Thank you for having me.